Welcome to the Preceptor Development video on providing feedback to learners, principles, and approach. In this session, you will learn how to distinguish assessment, feedback, and evaluation within the context of adult learning and with reference to your own clinical setting. You'll be able to describe strategies for providing effective feedback to various types of learners in your workplace and discuss an approach to self-assessing and improving your own feedback delivery skills. We'll begin with a few adult learning principles. Assessment is essentially data collection, and during the evaluation process, we interpret or judge that data based on performance. And then feedback involves using that data to promote student learning. An example of assessment is to directly observe a student demonstrating a component of the physical exam. An example of evaluation is judging that student's performance, including their strengths and deficiencies. And feedback is the process of sharing those strengths and deficiencies. This slide depicts the learning cycle during clinical placements. At the beginning of your time with students, you can plan learning and how that will occur throughout the course of their rotation with you. The supervised clinical experiences a student have consist of the learning, and throughout the rotation, you should be actively assessing students' knowledge, attitude, and skills, and providing feedback during that process through evaluation. Effective feedback is important because it promotes learning, informing students of their progress, their needs for improvement, and it motivates student engagement in learning. There are multiple factors that promote and/or inhibit learning in clinical settings. The orange arrow indicates learner variables that can affect this process. The red arrow indicates the factors that may affect educators during that process. And there are also clinical site factors to be considered. As you review this slide, consider which factors have affected student learning in your experience as well as in your role as a clinical educator. To be effective in providing feedback, you should consider the structure, format, and content elements. In regard to structure, you need to aim to prepare the student to receive feedback, directly observe knowledge, skills, or attitudes, and determine the time, timing, and location to give the feedback. Prepare the students to anticipate feedback. This slide includes statements that you can share with students to let them know that you will be providing feedback and how they can make that feedback useful. A critical element to assessing students is directly observing them. You can be deliberate and clear with the students in what skills you are going to directly observe, when those will be observed, and then inform them of the expectation and plan. Always solicit the permission of patients when you're involving students in their care, as well as when you're going to be directly observing and giving the student feedback. Always ensure there is sufficient time to both observe the student and provide feedback, and be prepared to make a plan for additional direct observation and experiences if needed to ensure that the student is meeting their learning objectives. Thoughtfully determine the time, timing, and location that you will provide feedback to students. You're going to want to determine how much time you need to observe the student and provide that feedback. You want to schedule this at a time that makes sense within your workflow and when you're providing care to patients. And in regard to location, you'll want to identify a quiet, private location to provide feedback and one where no sensitive information will be provided in front of coworkers or patients. Another domain that needs to be addressed when providing effective feedback is in regard to format, which includes verbal and nonverbal communication, documentation, and different feedback approaches. When you're providing feedback, you need to be mindful and deliberate with your verbal and nonverbal communication. You need to be thinking about what you're saying and how you say it. And your verbal and nonverbal messaging should be aligned. Oftentimes, it can be helpful to document feedback that you provide to students. This can be done on formal evaluation forms, but it can also be done informally. It can also be utilized to provide students with guidance on how they can close the loop on their learning as they plan to address the gaps in their knowledge or skills. There are various techniques for providing students with feedback. This slide depicts the Ask-Tell feedback model, in which the preceptor begins by asking the student what went well, and then telling the student what they felt went well. After that, the preceptor asks the student what they think could be improved, and then they tell the student what they feel can be improved as the preceptor. This method is particularly valuable because it provides the preceptor with insight into what the student is seeing as their strengths and areas for improvement, and also providing the preceptor with an opportunity to assert those strengths and weaknesses and provide additional information that the student can use to facilitate their own learning. There are various other feedback techniques, including the sandwich model, the 1-minute preceptor and 5-step microskills model, feedback levels, and the arch model. These techniques may be reviewed in future videos. The third domain for providing effective feedback is content, which involves focusing on strengths and deficits, specific strategies for improvement, and creating plans for further assessment. When providing students with feedback, focus on strengths, which helps identify competency and their improvements, as well as help students build confidence. This also provides context for gaps in knowledge and skills. Be sure to also focus on areas in which the student can improve, providing suggestions for how the student can improve in very specific ways. Oftentimes when setting goals, we can set SMART goals that are specific, measurable, attainable, relevant, and time-based. Recognize that as a clinical educator and preceptor, you can always be improving your feedback delivery skills, and you may need to modify those skills based on the learner type or where the learner is in their educational program. Important questions to reflect on are your own strengths. What could you do better? What are challenging situations or topics? And does the feedback you provide have the desirable outcomes for student learning? In addition to self-reflection, you can seek to improve your feedback skills by referencing role models from your own educational experience or current colleagues. You can seek mentorship or guidance from more experienced educators. Solicit direct feedback from the students throughout or at the end of their experience. Pursue faculty development opportunities, and reference guidelines from the health professions education literature. This concludes the session on providing effective feedback, principles for practice.